Hello, everyone. My name is Mary Heil, and I'd like to welcome you to Protected Tomorrows. Our webinar today is titled Taking the Confusion Out of Government Benefits. And now I'd like to introduce the president and founder of Protected Tomorrows, Mary Ann Ellert.
And hello, thank you, Mary. And we are going to get started on one of our favorite topics, government benefits. So I know one thing that people are confused about it. And no wonder, because sometimes you apply for something and they decline you, but it wasn't what you were applying for. And things like that happen, right? So we're going to try to make it simple so that you have an understanding of how the process works, when to apply, what the rules are. And we're going to try to have some fun while we're doing that as well. So why do I do this? And if you listen to the first class, some of you might be looking at these out of order, and there might be different classes that you're looking at through time, but I do it because of my sister. She's there spearheading everything I do and giving me encouragement, even though she's no longer with us. My sister was 4 years younger than me, and she had cerebral palsy. So I lived through the journey of watching my parents not know and then know when I was a little girl at that time, but watching them struggle through why is Marcia different, getting a name to what Marcia has. I'm trying to talk to the other 5 children about the disability and how each of our roles were going to play into her life. Watching them, I was pretty young when she was 2 and they got the diagnosis, hearing them give me my instructions as I got older and what I was going to be responsible for. But these pictures depict a lot of the things that Marcia loved. She was in Special Olympics. She loved bowling. She loved cheerleading for Clearbrook. She loved her wheelchair racing, and she loved to go to the casino with my parents. And this is a picture of my sister and I at my parents' 50th wedding anniversary, and we had a blast that night. But my job was to be her sister. So sometimes when I'm talking to you and teaching you, I'm speaking as a sister, but sometimes I'm also speaking as a mom because I have a son with special needs. So over the years, I've learned lots of different things. When I started out doing this, I didn't know anything about SSI, Medicaid, Medicare, all those programs. And I will tell you that I'm a financial professional, and most financial professionals don't know this. We don't get trained as a certified financial planner of what this means and how special needs trusts play into it. But we also, without being a family member, don't understand what parents face on a regular basis. So my goal is always to, the same as your goal, right? Your goal is to make sure your child is safe and happy. That's our mission here at Protected Tomorrows, but we take it from a different perspective. We're trying to give parents the power to be feeling less confused and the ability to be empowered in being able to plan for your family member's life, okay? So part of that empowerment comes from putting together a planning program for you. And we're going to be talking about one of those steps today, which is number 4. And we started out by talking about how complex planning is for everybody. As we go through life, we're supposed to understand money. We're supposed to understand the legal stuff we should do. We're supposed to understand taxes around April 15th. All these things we're supposed to know as grownups that we didn't get taught as children, right? And all of a sudden, we are not just grownups, but we are grownups that have to know even more than the average family in regard to special needs planning. So we created an 8-step process so that we can take families through each piece one at a time and build your knowledge and allow you to feel that you have some control over the next steps. A lot of the information we're going to be talking about is on our website. I invite you to look at that because there's all kinds of things that change, and we will post those things. And there's a lot of different information on our website if you're curious. And the other thing I always talk about in a lot of our classes is how to build your team, how to build your dream team. And having to do with government benefits, this is really important because the dream team consists of your person with a disability in the middle and your family surrounding them and all the other players, the guardians and trustees, and all the people that we have to bring into play to help our child And wow, government benefits touches a lot of them, right? It has to do with guardianship and what the guardians need to know. It has to do with the programs that are going to be paid for by these benefits. It has to do with money that's going to come in to pay medical bills. So it's a really important part that we teach our team and we teach our coaches, and we make sure that everybody that works with us knows enough about this to work together well. So my goal today is to let you have an awareness of what the benefits are all about. Some of you might have a child who's 2, some might have a child who's 18, ready to apply. You might have a child who's you're, maybe 40, maybe 30, maybe 20, whatever age your child is. Benefits seem to impact them, and they change as we age. So let's talk about things that we need to be thinking about. I'm going to repeat some of the things that I talked about if you watched the first class, which was the overview. And so remember, we talked about what's really driving us, right? How do we structure the planning that we're doing, especially around government benefits? And when I take a candid look, what I mean is we need to always be truthful. It's a very important attribute we need to have as parents about where we are at and where our child's at. And so when we're talking about benefits, it's a trait that we need to apply to the application process. I do know that when we talk about what we want, we talked about wanting our child to be happy and to be independent and to be financially secure, right? And we talk about our fears, and some of our fears are having our child lose their benefits. I hear people say that, because what if I do something wrong? Oh my gosh, is my child going to lose that Medicaid that's paying for so many things? Are they going to lose their waiver money? Are they going to lose the check that they get? So knowledge is what helps us be empowered in order to not have those fears and to make sure that we're taking the right step. And the other thing we talk about a lot is creating the vision for our child's future, and all the things they need of where they're going to live and the medical bills and how they're going to have fun and how they're going to continue education, all those things. And one of the base of that pyramid of all the things we need to put in place relative to providing that life, you'll see is benefits. So today we're going to talk about the importance of understanding them and how do they work. So let's get started and thinking about how do you capture these benefits? What do you have to do? What do you have to say? What words do you use? And where can you make mistakes? So I'm going to take the circle. I created this circle to kind of help us understand the different programs. And it's not that hard once you understand the 2 kinds of programs. So the first kind of programs we're going to talk about are programs that are entitlements. That means that your family member with a disability or whoever is getting benefits is entitled to something, but they're entitled to them because they bought them. So that's the basis on which some of these benefits work. So I've been working for a long time, and I'm entitled because I have had somebody take FICA out of my paycheck. And FICA is Social Security and Medicare. And as long as that check is coming out of my paycheck and going to the government, it means I am buying into a program that I am entitled to. Now, some of us, like my son or my sister, didn't have entitlements, okay, on their own. They didn't work. They weren't able to work. And so or if they did work, they didn't make enough in a year to get credits over time to get the credits you need to have those entitled programs. So there's a whole nother set of programs that are needs-based that we're going to talk about. And understanding the rules is one of the most important things you can do as a family member of a person with a disability. Now, some of the programs are money. They're actually cash, right? And other programs are going to pay for healthcare and programs and maybe a job coach and residential support. And some of these programs are funded by the state and some of them are funded by the feds. And where they come from is important to understand so that we understand how those programs fit. So let's start with the beginning. Let's start with an entitlement program that's going to give cash, all right? So when these programs apply, I'm going to talk about SSDI, Social Security Disability Insurance first. That is a program that we put money into out of our paychecks. And if I'm working and I've paid into that program and I have 20 current quarters, I am entitled to SSDI if I can prove I have a disability. How do I prove that? Well, I have to prove that I cannot make so much that it will limit, I can make so little that it's limiting my ability to live safely, right? Basically. But I have to prove that I have paid into a system and I bought it, right? So I have to show the ticket that I got it. So the income rules apply to that benefit. And the income rule changes from year to year. It's the year 2021. And so that income number is $13.10 a month. So I have to be able to prove to Social Security that I have an income limitation, how much I make, my earned income. And I have to prove it with medical records. I have to prove it. I just can't say, well, I can't make it because the market's bad. I have to show that I have a disability with medical records to show that I can't make that money. And if I can prove that, I can have money in the bank. All right. I can have a 401k from my job. I can have money that I saved. It's about my income that this applies to. So once I can prove that A, I'm entitled, and B, I have a disability that's going to limit my income, and it's going to limit my income below that $13.10 a month, then I will get the benefit that I've applied for. Okay. So just remember, there's only an income limitation. I can still have assets to get this Social Security disability. And along with SSDI comes another program. It's called Medicare. So it's important to know that these two kind of go together. So when we look at that top quadrant of the circle, Medicare is what's going to pay doctor bills and hospital bills. Okay, it's the same program that seniors get. That's why it kind of goes along with that SSA or Social Security program, right? So after I've gotten Social Security disability, 2 years later from my application date, I become automatically eligible for Medicare. So those two go together, and I want you to keep that in mind. Most of us are talking about children who are disabled and are not entitled, but they do become entitled later. So I'll explain that, but I want you to understand this process of how it works. So the first thing, whenever we apply for benefits for disability, the first thing the government looks at is somebody entitled? So if you have a child with a disability and you apply for another program, the first thing they do is say, do they fit in this category? So many people call and say, well, you told me it works and my child would be eligible, and they got to decline. This is what they're declining at that first time roundabout. If you're applying for someone, if you're applying for someone who has worked part of their career and then becomes disabled, this is probably what they'd be going after and be getting approved for. But if it's something like like my son or my sister, they didn't have the work rules. And so when they applied for the benefit, they got turned down the first time for this. And then what happens is they go into the automatic application process for SSI. Okay. So SSI is supplemental security income. Okay. It is different than Social Security. SSI, both federal programs, but SSI is for people who don't have the entitlement program. Therefore, different rules. If you didn't buy it, you got to prove that you're eligible for this. And there's two rules. So for SSI, the rules are: one, you have to prove you're disabled, just like the other program. So again, it's 2021 right now when we're talking, and the substantial gainful activity amount, which is the amount that is, if you make more than that, you are considered to make enough. But if you make less than the $13.10 a month, we have proven a disability. So we're talking about somebody applying for this, and the rules apply to the person applying, but it also could apply to their parents if they're a minor. So I'm not going into all the programs for children in this class. I'm going to be talking about what happens when your child turns 18, okay? So sometimes people come to us and might say, my child's 16, they have a disability, can they get this SSI? Maybe, but the maybe is dependent upon what the parents have or make. And I'm not going to go that into here because most parents have a job, not everyone, but most parents have a job and they have assets enough, even if it's limited, enough to disqualify their child. So let's talk about instead when the child turns 18. They have a disability, they haven't worked, they don't have an entitlement. So we need to prove two things. We need to prove they have a disability, and we have to prove that they have limited assets to get this program. So the first thing they do is you put this SSI application in. The person has to be over 18. When I mean over 18, it has to be the month after their 18th birthday. unless they were born on the first day of a month. So I'm going to use my sister as an example. Her birthday was April 23rd. And so she became eligible for SSI to apply on May 1st, because anytime during April, she might have been a minor, and therefore they could have counted my parents' assets and income. So when your child turns 18, you apply for this if you're ready, right? You got to make sure you have all the rules followed. So the first thing we need to be sure is that we have good medical records. Do we have medical records that proves that this person, because of their disability, cannot make 1310 a month? So if you've been in the special education system, you've been seeing doctors. Sometimes people come to me and they haven't seen doctors for years. So get a checkup, have your child go to their doctor and get current medical records, okay? You might have them from when they were born and never seen the doctor again because relatively, except for their disability, they haven't been sick. So you need to make sure that you have good current records. You can also use IEPs. You can use social work reports from the school. We're looking for what is stopping this child from making that substantial gainful activity or 1310 a month. So that's rule number one. We have to prove that. Rule number two is we have to prove they don't have assets that fall out of the range of acceptable. So what are the assets they can have? They can own a home. They can have a car. They can have a funeral plan, which includes some life insurance. They can also have $2,000, and they can have an ABLE account, which is one of the classes we're going to do coming up. Okay, so how do we prove that? Well, house. Probably your child doesn't own a home. Sometimes it works out that when we're applying and the child does happen to have a house, the parents created a house for this child or some kind of a home program, or whatever it may be, they may have a home as long as they're living in it, right? But most of our children aren't going to have a home that they own. A car. They can't have a car if they don't drive. But if they can drive and they have a car is an acceptable asset. A prepaid funeral. So let's say that you have just too much in your child's name and you would like to take care of that. That's an asset your child can own. They can also have the $2,000. Now, what is in that $2,000? Everything that has their name on it. Checking accounts, savings accounts, stocks, bonds, mutual funds. Social Security asks for lots of questions. What about mineral rights? All those kind of assets that somebody might have inherited someplace. Savings bonds, life insurance. So those are things that kind of get us caught up sometimes. Why? Well, savings accounts, grandmas give savings bonds when the child's born. Look in the drawers. Make sure that they don't have any savings bonds. The savings bonds pertain to the ones that has your child's name on it. If their name is on it, but someone else's name is on it too, and you want to cash those out, you might be cashing them out in the other person's Social Security number. So it's the name and the Social Security number of your child that makes that savings bond count. Don't forget them, okay? If you have them in the drawer and you just say, well, they're not going to know about it. Yeah, they are, because the Federal Reserve and Social Security talk. So check for savings bonds. Sometimes I had somebody who applied for benefits, they got them. 10 years later, they found out that they had these savings bonds and there was too much assets. And so Social Security is going to come back and say, well, you had this money all this time. You really weren't eligible. You need to give us the money back. So being really diligent in this process is really important. Okay, so we talked about savings bonds. What about life insurance? People sometimes, your life insurance agent comes, well, your child's young. It's a good time to buy life insurance because you don't know what's going to happen in the future. And so you buy this life insurance policy for your child. Well, there's two kinds of life insurance. There's the kind that's term insurance. It has no value until the person dies. We don't care about that. You can't cash that in and have it worth anything. But whole life insurance or universal life insurance has a cash value to it. And those could count. So if you bought your child a $10,000 life insurance policy at their birth, and it's accumulated some cash because you've been paying the premiums, and it has, let's say, $2,200 of cash in it, that's cash. That's your child's. Because even if you bought it when they turn 18, most policies say when the child turns of age, the policy belongs to them. So check all the little things that might kind of, make this not work for you. Right? So asset rules, we have to make sure we follow them. So let's say we have gotten all the information and medical information to prove your child has a disability. and we have gotten all the assets together. The other account is an ABLE account, which is relatively new. And so if there is money that you have in your child's name, let's say you ended up having $5,000 in your child's bank account, we could take 4,000 of it and put it into an ABLE account, which we'll talk about in another class how to use, because it's got a lot of rules, but just remember that they can have a house, a car, if they can drive, prepaid funeral, $2,000, and an ABLE account. All right. So let's say you've done all that. So you say, I'm ready to apply. So you go online and you put the application in. They ask you a lot of questions. You can go to the Social Security office too, but it's pretty simple to do from home. You have to put in the doctor's information, the hospital's information, because they're going to request records from those doctors. You got to make sure they call the doctors and say you're going to be getting this, so that everybody's kind of, I say it's a team, right? We want the team to play nicely together and everybody do their part. So we go through all this, and Social Security then determines, does your child really have a disability? And then secondly, do they follow the financial rules? So they're going to ask a few questions as we go through this. They're going to ask questions about, like, well, where does your child live? Well, if they're 18, they're probably living where? At home, because they're probably still in special ed or in some kind of a program, right? So when we answer that question and ask, where is your child going to live? You should be answering the question, well, they live in a separate household in my home and they pay me room and board. Now, there's several ways to do that. Sometimes you'll have people say room and board. Sometimes you say, well, they're going to pay their fair share. You can do either one, but just understand them each, that if you're doing room and board, you're saying that they're going to be paying me rent because they're going to room and board. They're going to pay me some money. And you said, well, I looked on Craigslist and a room in my house would cost X. So they're kind of have their separate own household, and they're going to give me maybe $300 a month rent, room and board. And they're going to give you a form to fill out that say your child's a renter. If you do fair share, you're going to say, what are all the costs in the household? And then you're going to split them by the number of people in the household, and you're going to get your child's fair share for the costs of the house and the food and the utilities and things that cost to live in that house. Be careful. If you have very expensive living expenses, and there's only 3 of you in the house, your child's fair share has to be less than what they're going to get. Because if they're going to have a fair share greater and they can't pay it, then basically you are subsidizing them, and that's going to count against your child. So I usually recommend that you have your child pay room and board, and then you can pick the amount. And do you have to claim this on your tax return? Well, you do, parents. If you're going to get room and board, you're going to claim the portion that's rental portion on a Schedule E on your tax return. You talk to your accountant about that. Accountant may say, well, you don't really have to. You're charging your child rent. You should. The right thing to do is you say you're a landlord. You're going to take your expenses against that income. And in reality, people say, oh, you're going to pay more rent. Well, in reality, by the time you say I'm a landlord, this is what rent I'm getting, here's my share of the expenses that pertain to that room, there's not going to be any income in most cases. So don't be afraid of taking that approach. It's pretty simple once you know how to do it. So now we have taken care of the fact that they can't come back to you and say, well, your child's living with you, you're giving them a free place to live, and so we're going to give them 1/3 of the less benefit, right? So how much is SSI anyway? What are we going through all these hoops for? It's 2021, and the amount of SSI monthly is $794. Okay, so let's say we jump through the hoops, we do everything that Social Security tells us to do, we get the benefit of $794. But when we started this process, we started it months ago. I've had people take 3 months, 4 months, 5 months, 6 months. The application date starts the dollar bucket ticking. And so let's say it takes 3 months to get approved. And so at the end of the 3 months, your child gets a check, and the check is $794 times 3, or $794 times 5 if it took 5 months, or $794 times 12 if it took a year. Uh-oh, now your child has all this money, and they're going to put it in their bank account. And how much can they have in their bank account? $2,000 or of everything. Let's say they have some savings bonds and they have a $500 of savings bonds. They can only have $1,500 in their bank account. Okay. So I want you to keep that in mind, that $2,000 limit. Well, they're going to get all this back pay. They have time to spend the back pay, right? But the other thing you need to know is you said, I'm going to use the rental example. You said to Social Security and you signed an agreement with your child that they're going to pay you room and board. So if you get 3 months of benefits, but you said your child's going to give you $300 for room and board, you've got to take it. You're going to take the $900 for those 3 months out of the child's account because it's your money. Okay. Now, some families go, I don't want to charge my child rent. And, I feel kind of guilty doing that. You're helping your child. If your child's high enough functioning, or maybe you're teaching them about that money exchange. If they're not, you're making sure that they keep their benefits. They're keeping this SSI check coming in every month to their account. All right. If that amount is too much, what could you do if you got 3 months worth and you took the $300 out, or you got 6 months worth, and there's more than $2,000? I just want you to remember the word ABLE account, all right? Because the ABLE account is a place when we get too much money in our child's name between their, maybe an investment that they have, or money in their life insurance policy. If we total those up and it gets close to $2,000, we can take money and move it over to the ABLE account, connect the two. Right? And when we talk about ABLE, we will talk about that, but I want you to remember that's a tool to keep your child's money under the $2,000. All right. So they get the SSI. Now what? They said it's getting their money. Well, there's another program that comes along with that. In some states, it's 2 applications. In some states, it's 1. It's different by state. But many states you apply. And if you have to apply separately for Medicaid, you might be sending in the SSI approval along with other documents like a birth certificate to validate information that the Social Security system is looking for. So what is this Medicaid information, or Medi-Cal? If you are in California, what is this program about? Well, this is, I call it the golden ticket. This is the program that writes the big checks. So $794 a month is good money, but it's not enough to provide for your child. But you're going to need, in the future, you're going to need some health care. You might need your child get into some programs that are Medicaid funded. You might need a job coach that is Medicaid funded, and you might need it for services. Okay, there's all kinds of services that your child gets on a waiting list for, and they have to have Medicaid in order to get that service. They might go into a residential setting that is funded by Medicaid. So Medicaid is the ticket into these programs. Okay, so should you get Medicaid, if you're thinking about it as medical, right? Your child is you're working. Okay, mom and dad are working. You have a job, and your child's on your health insurance. So you say, well, let's not worry about this Medicaid thing right away. Let's do it later. You can do that. You can let your child stay on their health insurance plan, and actually under Obamacare, your child can stay on your health insurance till right now it's till the age of 26. Well, what happens later? What happens when they're not? When they're 27? What happens? Well, in most states, there's a statute that says your child can stay on your group health insurance plan as long as you have it. Okay, as long as you can prove your child has a disability. It's different by state. Some states have rules that says your child can stay on the plan as long as you have it, if it's a group plan A and the company isn't self-funding it. So you have to kind of learn about that. You have to find out where's my it's not about where you live, it's about where the company is domiciled. So do I work for a company that's in Illinois? I'm in Illinois. Illinois statute says that they must do it if it's a group plan and it's not the company isn't self-funding the insurance. So I want you to remember that if your child is starting to get older and you're worried about them having to come off the health insurance plan, you go to your HR department. Now, if they tell you no, ask again, do your research, find out. Because sometimes the HR person might be a junior person. They might not have had this experience unless they're, no, 26, the kids have to come off at 27. Say my child has a disability. What do you know about that? And they go, I don't know if it's anything different. Okay. We as parents have to be advocates. We have to look up the rules. So if you don't know this, if you don't know what your state covers, you'll find an email address at the end of this presentation. You can check with us and we'll let you know what your state does. But it's a state where the company is domiciled. So I live in a state where there's a big company here and they have offices all over the country. So if somebody in California works for this company, Illinois laws apply, even though they work in California for that company. So they have to know what the Illinois rules are, right? So Illinois rules are very good. And if that person lives in a state that doesn't have those rules, it's the company's rules state that apply. So that company, the employees there, the individuals with disabilities get to stay on the parents' plan. Okay, all right. So what then happens? This child stays on the plan. Should I apply for Medicaid? Yes. Then what happens is health insurance is first, Medicaid applies second. So let's say you really don't have a great drug plan, and your child, you give the drug company, the drugstore, your child's health insurance card and the Medicaid card. And if you don't have you have a high deductible, maybe Medicaid's deductible would be lower. So you have two plans, all right? That's how it works. When your child comes out of school and they're maybe going to be in some programs that they need supports, you probably can't get into those programs without Medicaid. If you're in a state that has funding after school for services and all kinds of support systems, you probably can't get those without Medicaid. So people sometimes ask me, well, should I just wait? I say do it. You know, we're parents. We know it. Not everybody in our family is going to know it if something happens to us. We have the responsibility to make sure this takes place. So don't wait. When your child's eligible, put the applications in. Yes, it's kind of frustrating to do it. Yes, do it. Okay, it's our job. Okay. I have a philosophy that whatever I can do, I'm going to do. I don't want to leave it to somebody else. We're going to talk later about the importance of communicating this to other people. We talked about it in the first class as well, but I'm going to try to do everything I can because I want to make sure that my son is in every program he can get to. I don't want somebody else to have to learn on this. I'm learning it. And so I'm going to try to leave all the instructions to someone, but I still want that responsibility. All right. So you see how the programs work. Above the line, income rules only. We only have to prove disability. Below the line, we have asset limitations too. So in the beginning, I said some of the rules are a little different relative to when we retire. And the last class I'm going to do is going to be specifically talking about retirement, but I'm just going to give you a quick overview of what could happen. All right. So another piece of information is you have to know your Social Security. If you've never done this before, you used to get statements like this, right, in the mail, and they don't mail them to you anymore unless you're older and you're closer to retirement. You can go to socialsecurity.gov and pull up your record. Open an account. They need your Social Security number. They have you sign a username and password. It's pretty secure because I've forgotten my password a couple of times and it's hard to get it back. So when you get it, save it, right? I never, they care about alphabetizing and capitalizing and everything, the numbers and you need to make it secure, but you need to remember it. So you can go into Social Security and get this information about yourself. So what does it have on it? Well, this is kind of a snapshot of some of the information for someone. This person had a birth date of 1965, somebody's dad. It says for retirement, this person, and it gives you how much you're going to get when you're full retirement age, how much you're going to get when you're 70, how much you're going to get when you're 62. So this particular person could get $1,800 when they were 67 years old, but they take it early. They'd only get $1,197. But if they wait till they're 70, they're going to get $2,288. So it's all based upon how much someone paid it. Okay, I'm going to pretend this is dad's record. This also said if dad were going to become disabled himself, he would get $1,643 a month if he applied for his SSDI. Remember that was the top on the circle at the top. Then there's family members. I was talking to a lady the other day. She goes, we were talking about a couple and she wanted to know how much each of them would get. And the mom had never worked. So I said, well, dad's going to get at full retirement $1,804. So mom is eligible for half of dad's or all of her own. But mom didn't have any record. So she was going to be eligible for how much? $1,902, half of dad's, right? Now she applied before her full retirement age, her own age 67, she would get less because there's a penalty for applying early. So she might not get the 902, she might get 600, but she is going to get something from dad's record. If she doesn't have her own record was $2,000 a month, she's better off taking her own, right? Okay. But let's look at the survivor piece too. There's a couple numbers here. People don't always realize this happens. But when the parent gets benefits, either because they're retired or they became disabled or they died, there are benefits for our minor children. So when you see the survivor benefits, it says your child, a minor child, could get $1,257 from the parent's record. It also applies to an adult disabled child. It's called Disabled Adult Child Benefit, DAC. So when you hear DAC, that's what they're talking about. When a parent retires or becomes disabled or dies, there's this benefit that a child or a disabled child, as an adult, can get a benefit. And the benefit is equal to, while the parent's alive, it's 1/2 of their 67 benefit. And when the parent, this is the max, and when the parent dies, it's 2/3 of the parent's age 67 or full retirement. We call it FRA, full retirement benefit. Kind of complicated, right? So there's two numbers I want you to see, the 1257. Then I want you to see, there's also a number, because people say, well, first of all, when I was talking to the couple the other day, dad could get 1,800 and mom could get 902. So mom says, I shouldn't take the 902 because then dad will get the whole 1,800. Not how it works. Dad will get 1,804 and mom will get an additional 902 on top of that. But those two numbers get added together to make sure they're never over the family max, which is in this case, 3,116. So there's a lot of numbers here. You've got to know your numbers. You have to know what they say in order to do planning for your child. So pull your record up. And if you do it before the 5th class, which is retiring for 3, those will be really important numbers for you to have. But I'm going to give you a really simple example today. And then we do the retiring for 3 class, you'll be able to do some work on your own to figure out how it's going to work for you. Okay. So let's go through a simple example for this couple. The person with the disability turns 18 and the mom and dad are still working. So we went and did that SSI application. I'm assuming it's this year, 2021. So we got the child their 794 and their Medicaid. So that's the stage where we're at. I call it stage 1. Okay. Then what happens is dad retires. Let's say dad and mom are the same age. So dad goes into Social Security office. He's 67. He goes, show me the money. Okay. So when the dad retires, dad gets, let's go back to that other record. Dad gets 1,804 and mom never works. She gets 902. So the Social Security office at that time when dad's applying says, well, I see you do you have any children with a disability? And dad says, yeah. Okay. So the child was getting the 794, right? But when dad retires, they're going to calculate out how much is left on dad's record after dad took his and mom took hers. Then there was some money left and it was $410. Of that max, there was $410 left. So they give the child with a disability $410 out of a different bucket, the SSA bucket. See, it says $410. And so what that did is it lowered the SSI, because SSI is to bring you up to 794 and you'll never get more. So once you start getting other money, they lower your SSI bucket and increase your SSA bucket. So this child is getting 794. Well, they were getting 794 before. So are they trying to fool us? Is the government just saying, oh, we're going to play a numbers game. You have 794. We're going to make you think it's really good. So we're going to give it to you in 2 checks. Not quite. So this is what happens. There's a really good reason when your child goes under the Medicare system, because there's going to be 2 checks. Let's talk about it. When your child goes up, remember when they went up in the circle, let's look to the right. And there's something called Medicare. So when you retire and your child goes into the Social Security world, this is a really good thing, because 2 years after they get into that Social Security world, they get Medicare. And Medicare is a really good health plan that seniors have. And now your child gets it too. So we were worried about when we retire, because if we're in a plan where our child's on our group plan, and when we retire, that group plan goes away, and now our child only has Medicaid. Well, a lot of doctors don't take Medicaid. We're worried about that. So when we retire, we're going to talk about the last class about how do you time all of this to make sure your child gets the best they can get. But I just want you to understand that those go together. When they get Social Security and they go into that DAC program, 2 years later, they get Medicare. Okay, got it. So they're still getting their 794, just coming from 2 buckets, and they're getting their Medicare. Dad passes away. Mom gets dad's. Okay, so if mom can actually get dad's record, if it's more, that's a spousal benefit. So what happens if dad passes away and mom starts to get some? And then what happens when mom passes away? What's going to happen? Does it all go away? No. What happens is, remember we said there was a maximum amount the child could get on the program? If we look back here, I'm going to come back, and we see that the maximum amount a child can get is $1,257. All right, that was 2/3 of the dad's 67 amount. So I'm going to come all the way back and go back to where we were. And what happens? The child is now not getting 794, but getting that maximum amount of 1257. And look at which bucket it's coming out of. It's all coming out of the Social Security bucket in the DAC program. So what happens to the other benefits? Medicare still stays in there because it's once they've had the Social Security for 2 years, they're in that Medicare system. What happens to SSI? It's gone because they're getting 1257, and that's more than 794. But do they lose their Medicaid? No, as long as they still follow the rules, they still have a disability, and they still don't have more than a house, car, prepaid funeral, $2,000 in an ABLE account. Okay, so there's some transition of these benefits that change over time, and it's really important for you as parents to understand this. And it's complex. Come to the last class, we're going to talk about your specific situation and how will it work when you retire, but it's very important. All right, so my takeaway from this class is understand the limitations on your child and know your own benefits, because that's really important. Okay, so what do you need to remember? Learn about group health insurance plans at your work. Find out what state your company is domiciled in. Find out what that state's rules are. Find out, is your child going to be able to stay on past 26? Be aware of, if your plan is self-insured, is there limitations? What are you going to have to prove when your child's 26 to prove that they're disabled? Know that. 2, know your own Social Security benefits. It's going to impact the planning of your child. They're not going to just stay on SSI. 3, this is the hard part, benefits are going to change. So they've changed only not that much, okay? When I started doing this, the benefit was like $700 a month. It's gone up now to $794, woohoo. But the child could have less dollars. Now they can have $1,310 of income. It used to be a very low number. Benefits have gone up a little bit every year. Health insurance laws have changed. Stuff changes. So we as parents need to stay up to speed with all this going on. You know, we've seen benefits, the SSI amount itself come up from a much lower number in the 30 years. I can remember how low it was back then. 794 isn't a huge number, but it's better than 0. Okay, know how the health insurance works, knows how your Social Security benefits are going to benefit your child, and how do you think that through? Those are your takeaways. So how are you going to do this? Because when we talked about planning for your child, we talked about the benefits are really important. We talked about how it fits into the pyramid of what they're going to need. And we talked about the limitations they're going to have. So how are we ever going to make sure our child has enough in the bucket that we're going to leave them when we pass away if they can have more than a house, car, prepaid funeral, and $2,000 and an ABLE account? How are we going to do this? So next class is we're going to talk about the legal things that we can do to make sure this all works. Okay, that's our next class. I invite you to participate in that. And I also remind you from the first class, we talk about the importance of documenting this for future family members. So we just talked about a really important piece, and I encourage you to, if your child's already on benefits, pull some things out, make snapshots of them, store the information of how it works, let people know that these limitations exist. So if they get the job of a future guardian or trustee, they understand how it works. Okay, so I always tell you, I give you homework, and your homework is always to fill out a little guilt card or write down two things. One, what are the questions you had on this class that you can bring to Saturdays or the next review class? We always have a Q&A after our classes, and the particular session we're talking about is going to be on a Saturday. So I encourage you, when you're listening to recorded sessions, that you jot down your questions. If everybody emailed me their questions, it'd be pretty hard to answer them quick enough, but I always do live Q&A sessions where people can call in with questions. So I encourage you to do that. And secondly, what did you learn that you need to do today? So I don't mind if you email us that, because you're just making a commitment to me, and we'll put it in our little system and send you a little reminder once in a while that you said you wanted to do something. Maybe yours is get online and open a Social Security card, open an account. So when are you going to do that by? You're going to do it by a week from today? Send me an email. Say, Marianne, I am opening up my account by this date. Okay. Or if it's to, think about the savings bonds in your child's name. Maybe you need to pull them out and see what they're all about, see how it's going to impact your child. Maybe it's telling grandma and grandpa, don't do that. Don't buy savings bonds. Fund an ABLE account, which we're going to talk about. Okay, so what are you going to do? Here again is the email address, info@protectedtomorrows.com. Send me a note saying, Marianne, this is what my commitment to this program is. This is what I'm going to do from this class. Okay, that is all I have for today. I look forward to next class, which is legal. And after legal, we're going to do one on ABLE accounts. And then we're going to do one as to how do you retire and fit your child's future into your retirement. Okay, and that is what I have today. And thank you. Have a great evening. Good night.